Hi everyone, welcome back, and today we're talking about tooth whitening. Whiter teeth make people look 5 to 10 years younger, and that is why most individuals at some point in their life will ask for bleaching methods and what's best for them. So there are different methods to bleach the teeth, and it really depends on the case. So it's best for the patients to consult their dentist and basically see why their teeth are discolored in order to find the best way to bleach their teeth. There are different types of discolorations that can occur on teeth. The first type is intrinsic stain or discoloration, and this means that the color of the tooth is coming from the inside out. And also there is extrinsic stain or discoloration, which means that the outside sources are making the tooth look darker. An example of intrinsic stain or discoloration, if your tooth has gone through a root canal procedure. This tooth is nerveless and is pulpless and doesn't have any blood supply and doesn't have that natural tooth color appearance. It goes dark. Another example is tetracycline staining, which is a change in the tooth structure while the individual is exposed to a specific type of antibiotic called tetracycline during the development of their teeth. And another example is fluorosis, which is the exposure of the individual to too much fluoride, basically. But if you want to know more about fluoride and supplementation, please check out the video that I already did, which I will link below or above, and you can find out more. So an example of extrinsic stain now, so basically the outside sources, is the exposure to smoking, coffee, tea, and a lot of other foods like red wine, blueberries, too many blueberries, that will stain the teeth over time. So different bleaching methods can be applied depending on the diagnosis of the discoloration of your teeth. Bleaching can be done in two ways. It can be done in office, so in the dental office, or at home, or it can be combined both at home and in office. Power bleaching or in-office bleaching can be done in office, and it's quicker because a higher percentage of the bleach is used, so it's done professionally to get a quicker end result. While home bleaching is the type of method where we provide a custom-made trays for the top teeth and the bottom teeth, and we provide the gels and give you the directions on how to apply these gels and how long to keep them at home. It depends on the brand that the dental offices use in terms of the directions, the specific directions to use at home. So basically you will get something like this, a tray for the top teeth and the bottom teeth, and we will give you the directions on how to place the gel inside and the length of time that you should be keeping it during the day. We have also types of bleaching methods that are over the counter to bleach at home as home whitening kits. And these are basically ready-made. They have strips inside, so you can just place them on the teeth and follow the directions in the box. I already did a video on crest white strips and documented my journey on bleaching with crest white strips at home. So please check that out. I will be linking that down below or up here somewhere. And check it out and see how effective it was for my teeth. Different countries have different regulations on the type and the amount and the percentage of the bleach that can be used. Many patients ask, do you use a light to do a bleaching, in-office bleaching procedure? Do you use lasers to do a bleaching procedure? Because I heard that it's the best way and the most effective way to bleach the teeth. Well, let's debunk a myth here today. The research results are disappointing. There is no benefit to using a light while doing a whitening procedure, but it makes for good marketing. Lasers have also been tested, but they have not shown any significant difference either. A lot of patients are also concerned about complications. Can complications arise? Different complications can arise depending on the type of the whitening procedure chosen. It is very important that the person undertaking the whitening procedure should have a dental background. Aesthetic dentistry, which basically deals with the shape, the color, and the position of the teeth, and everything aesthetics. Periodontics, which deals with the gums and the bone and the surrounding structures of the tooth, and evaluate for a possible disease of the gums and the bone. Endodontics so the assessment of the root and its status, management of an emergency treatment in case it's needed, oral medicine and oral pathology, and an understanding of how the tooth whitening works and the procedures behind it. So there's a lot of controversies in terms of who should conduct a bleaching procedure, a beautician or a dental personnel. Because of the complications that can arise throughout the bleaching process or after, I strongly believe that a thorough knowledge of all of that I mentioned above and basically a dental personnel should be the one to conduct a bleaching procedure. Have you ever considered whitening or have you ever done whitening? What was your experience? Please let me know in the comment section below. I would really like to know. This is all for today's video. I hope you had a good time and I hope it was very informative. Stay safe.